We want to now talk to Martin Gower, former NHS chair, because yesterday we got a piece of startling news, I thought, from Wes Streeting, from the Health Secretary of State for Health and Social Care. He basically said that there are now an extra 1,500 GPs on the books brought in on a huge recruitment booster, so there's no more 8am Scramble for a GP appointment. Now, I've been asking how you have found that, and not many of you have said very much about it so far, so I'm interested in what you've got to say. If you've suddenly found that it's easier now to get a GP's appointment, please do let us know. Martin, very good morning to you, sir.
Good morning, Mike, and thank you for having me on.
Not at all.
This morning.
Yeah, I mean, I guess the first question I've got really is, where have these 1,500 GPs come from, if indeed they exist, and what were they doing?
Well, there's two issues with GPs. I mean, one is that too many of them, frankly, are part-time.
Yeah.
So maybe they've negotiated getting some of them to work a few more hours,
right,
which would effectively be like introducing more GPs. I mean, my own GP practice has 12 GPs, only 3 of whom work full-time.
Yeah.
So that's one possibility. The other possibility is that we've spirited some away from other countries and brought them in. There's obviously been an ongoing campaign to import both doctors and nurses from countries like India, the Philippines, Pakistan and others.
Yeah.
But there's a mystery how suddenly we've managed to hire 1,500 GPs.
Well, it's quite a big number, isn't it? I mean, if they'd said, oh, we've managed to hire 100 or something, I'd go, well, all right, fair enough. But 1,500, it seems a large amount of people who could not possibly have just all been working in the system. And I know that, for example, I don't know whether you've heard me talking about it, but I've had a sort of an ongoing rant at myself, I suppose, over the past month or so, because I don't believe, for example, that they're reducing waiting lists. They are, I know, giving more people, you know, more kind of appointments at weekends than they used to do, and they're getting more diagnostic work done and that kind of thing. But the actual waiting list for proper procedures are not going down, because my fervent belief, and this is backed up by a lot of people getting in touch with me, is that people get given an appointment, and then shortly before they're about to have the appointment, it gets cancelled and they sort of get moved off onto another list.
I think that's possibly true. And of course, a few days ago, we had this information that about £500 million has been lost in terms of giving procedures to visitors, health tourists, as they're sometimes called. And that, of course, has the impact of increasing waiting lists. It moves other people down the list.
Yeah.
So there's a lot of things about the data floating around in the NHS that, frankly, unless you spend hours and hours delving into precisely how they've arrived at it,
right,
manipulated it, NHS data is, I always describe it as like a piano. You can play any tune you like on it. And I think Mr. Streeting and his predecessors, in all fairness, have been fairly deft at achieving that.
Yes. And that's my suspicion with this as well, that 1,500 probably is not quite the number. You know, great if they've managed to get more GPs in, and everyone would applaud them for that. But I haven't seen any great number of people listening to this show or watching this show who have said to me, oh, yeah, you know, actually, my GP's a lot better. Some people say their GPs actually work pretty well. There's always been that, and some don't. But the idea that suddenly they're now better than they were, I think, is what's in doubt for me anyway. And maybe, as you say, they're counting numbers of heads as opposed to counting people who only used to work 3 days a week who now work 5.
Mike, the other issue is that a lot of people these days are referred to a practice nurse or some other member of the practice who isn't actually medically qualified.
Right.
And that, of course, can free up considerable amounts of GP time. I don't object to that, frankly. If you talk to GPs, and up until 2000, when I left the NHS, I talked to a lot of GPs, and the story was always quite similar. That about 4 out of 10 of the people in the waiting room needn't have seen a GP. Right. There were these repeated appointments, people who came back and kept on making more appointments, who really sort of clogged up the system to some degree. And of course, there was also the people who made an appointment and didn't show up.
Right.
So you hear that GPs are very stressed out and horrendously pressured, and haven't got enough capacity. And I then always hear that there's a whole load of people trying to make appointments to GPs and actually need to see one.
Yes. Yeah, I think that's right. I mean, I certainly know plenty of people, and we've heard from them every single day that we've talked on this show, that they do have to get the 8am Scramble, and many of them say, if I can't get through until about 8:05, I get through and only to be told, well, all the appointments have now gone, so you might have to try back tomorrow.
I mean, Mike, the one piece of reform that Mr. Streeting ought to be doing is removing the system that says GPs are paid on capitation.
Ah.
In other words, they're paid by how many people are registered with the practice,
Right.
with a bit of a formula based on their demographics, age, and all that sort of stuff. But actually, that's not a great way to do it, because it's really an incentive for the GPs not to see people,
Yeah.
because they get paid anyway. Whereas in other countries, and I've studied that in quite some depth, most GPs are paid not on capitation, but on
Yeah.
activity.
Well, right. And that seems to
they're
make
paid for what
perfect
they
sense,
do.
doesn't it? That's what happens in France, isn't it?
Absolutely happens exactly as in France.
Yeah, and why on earth they couldn't change it to something like that? Because that's relatively easy to do, isn't it?
Or try to negotiate that with the BMA.
Yeah. Well, I think you put your finger on it, because not enough people, I think, understand how much influence the BMA has. For example, the BMA is responsible for not training enough doctors, because they didn't want to allow too many doctors into the sort of, secret profession, if you like. They don't like to have too many people wandering about, because they want to charge a premium for what it is that they do. And they're quite a militant union, really.
They're very much so. I mean, I've dealt with them firsthand on one or two issues, and it reminded me of my previous life in the newspaper industry, dealing with the print unions, which was a fascinating.
Yeah, it's a very interesting comparison, that. Yeah, absolutely right. So we remain to be, impressed with the way that the NHS has improved, but so far, I think I'm going to retain my scepticism about it.
Mike, until social care is incorporated with the NHS into a single service in your local community, it will never really improve that much.
Right.
I had the direct experience in the last trust I chaired of an integrated system where the local authority actually subcontracted all the decision making on adult social care to us. So if somebody could have the access to a nurse, to a physiotherapist, a mental health nurse, or indeed to a social worker who could look to where they could be best placed and where they could be best supported. Now that needs to be integrated. This is all pillar to post stuff, and until that's done properly, I mean, he is called the Secretary of State for Health and Social Care.
Yeah.
What he said is it's going to take 2 years to get rid of NHS England, which I think they're saying, well, they're not quite sure how it's going to shape up. Well, they should have been sure before they decided to scrap it, to be honest.
Yeah, absolutely right. Martin, good to talk to you. Martin Gower, the former NHS chair, giving us the benefit of his opinion. Similar to mine, which is that these 1,500 doctors might not quite be as sold. There may not be 1,500 extra doctors, as I suspected yesterday.